So it's always a rough spot when you're between people's lunch. And, anyways, but I appreciate the invitation to this event. It's been fantastic. I'm learning a lot, and I hope we can continue that conversation. So I am affiliated to the College of Science, also the College of Engineering here at Northeastern. I also have an affiliation with the School of Public Health at Harvard and Bouvet as well here at Northeastern. So, but my background is in physics. I'm an applied mathematician as well. So I'll be telling you a little bit about how I landed in the research that I'm doing right now. And just want to acknowledge that a lot of the work has been done with many of my students and collaborators. So I started getting involved into machine learning long ago, 2003, and we were analyzing aerial images to detect how people settle into informal settings in Mexico City. And I won't dwell too much on this because I want to show you a specific application. But I also have worked on with climate scientists and with atmospheric chemists teams that study how to model the global composition of the atmosphere in terms of emissions and greenhouse gases. And my role there has been to use machine learning to speed up the computations. Google Trends was mentioned by Chris, I think. So, for those of you who may remember this, Google developed an algorithm that was tracking the searches that we all do on our internet browsers, and they were collecting the temporal trends, and they realized that, in fact, the trends of searches related to influenza highly correlated with the number of visits with hospitals. And for those of you who may remember, it failed horribly for a couple of times, and so now lots of people who know about this believe that that is a failed avenue of research, except that we showed a year, like probably 4 years after Google Trends had been launched, that the problem was not the data, it was their algorithm. So we proposed a machine learning approach that we hoped Google should have implemented, but they didn't. And we showed that, in fact, there was a way to do it right. But the citations for a paper that criticized Google Trends are like in the multiple thousands, whereas in the citations that we get in our papers where we fixed the algorithm, and in fact, that Google incorporated it into their methods, you know, it has in the hundreds. So yeah, people know, but it became a niche, right? So now the common knowledge is that Google didn't work Google Trends, but I'll tell you more about this in a second. I also worked at Boston Children's Hospital, and so there was a talk earlier, and so I spent 7 years there developing machine learning models to streamline hospital operations as well as intensive care unit treatments. And recently, and relevant to this group of social scientists, we use machine learning to identify the role of political leaning in outcomes during the COVID-19 pandemic in the US. So I'm kind of happy that our paper is not extremely highly cited to see this charged and under the current environment, and I will not finish the sentence there. But so we wrote about this, and this is one of the slides, figures in the paper, where we showed that higher mortality occurred in basically Republican leaning. So 4 times, or 3 times to 4 times more mortality per capita was observed in places that voted Republican. In any case, I will not get into that, but you know, the paper is out there. What I will tell you a little bit about, and I want you to keep me in check, I'll try to do this very quickly, is the use of these signals that we are creating when we use our devices to search. And I'm also looking, Chris, forward to the, you know, Anthropic or Claude trends or Gemini trends. But what you see up there are trends of the number of people that are searching for specific terms like bronchitis in the very top. And you see that it's moving because it's simulating how people were searching. And as you see, that looks a little bit like a vital signs, right, of a patient. This is specifically for the state of California. And what we have created in collaboration with one of my graduate students here at Northeastern is an early warning system that collects a lot of these searches and information from neighboring states to tell you when you should expect to see an outbreak in your state or in your city. So that tool is now being shared with the CDC, the Centers for Disease Control, which, 2 years ago, that was very exciting. We had a lot of funding. There was a center created called the Center for Forecasting and Outbreak Analytics during the Biden administration. And we were very excited. A lot of very interesting things in terms of pandemic preparedness. Under this administration, things have changed. But all this to say that we, during COVID, what we observed, well, first let me show you these plots. So these are just to show why we need these tools. And so currently our state-of-the-art modeling and forecasting approaches, the ones that are being shared with the CDC, they fail to capture when things are about to start. And for those of you who may work on time series analysis and forecasting, you know that, and even those in finance, there's like this momentum. So the models kind of tell you, what will happen is what we have seen. And so they're very slow to react, but we need to know exactly when things are going to get bad to prepare our healthcare systems. And the other reality is that the other point where we need a lot of information is when things have gotten to the worst part. And what you see in the far right, and these are, by the way, actual forecasts, shared by the CDC, by multiple teams. And what you see there is that we have this momentum, right? So the models, they take out, it's just going to keep going up, right? But then at some point, it would be useful to know when things are ending or slowing down. How much more time do I have? Should I continue a little bit? So the philosophy that we have in my lab is that, when you have a person who's very sick, you take them to the intensive care unit and you monitor them very closely. You put a lot of devices to check their hearts are doing well, their organs are functioning, etc. And so what we have proposed is, why don't we do that with our cities? So when you have a location, right, say Boston, then why are we not looking at everything as if we had a patient? And so whenever there's an anomaly in any of these, and Nick, you have, I think, some of your work is there in terms of smells, right? During COVID, the COVID pandemic, reviews on Amazon were spiking for, claiming that the smell in candles was not delivering what they thought they bought. And it turns out that what that was showing is the prevalence of anosmia, which is the inability to smell. And so that is one of these signals that was telling us there's a lot of COVID around, right? But in other words, we have lots of data from Twitter, for example. I know people here study Twitter. We have monitored the extent to which Twitter can also serve as a thermometer for how people are feeling, for healthcare purposes. We know that people are now very well trained to test themselves. They know how to swab themselves, and you can find if you have a disease like influenza or strep. So the proposal that we have shared with the CDC, and that's the current business model we have with them, is to incorporate everything that's happening into a unified system so that we can monitor our cities as if they were patients. So that's it. Thank you.
Thank you.